Thea Care welcomes you to a webinar recording on the topic of pelvic health. We are in conversation with Prashanti Ganesh, a pelvic floor specialist and the founder of Strength Systems. In this webinar, you will find all your answers on what is pelvic floor health, why is it important, what are some things you can do right away to improve your pelvic floor health, and also why is it important, especially for women. Take a close look and thank you for joining.
Right. Hi, Prashanti. How are you?
Hi. Thank you so much for having me over.
Oh, thank you so much for your time. So because you have to jump off very quickly, we'll quickly get started.
Sure.
Why don't you tell us a little bit about your work? And the most important question, that why is pelvic health so important, and not just for, again, reproductive reasons, but for overall health?
Okay, so I run a strength and conditioning gym in Chennai called Strength System. And I've been doing this for the last 10 years. Even though my gym is only 5 years old, I've been in the fitness industry for the last 10 years. And I basically teach women how to lift weights and get strong. And I primarily work with women on menstrual health, hormonal health. And now that I have more and more women getting stronger, I'm also finding that they're now starting to open up about pelvic floor and incontinence, which is very commonly associated with heavy lifting. So that got me into learning about the pelvic floor, and now almost every woman in my gym, as part of their warm-up, we do pelvic floor activation. Even our male trainers are very comfortable coaching our girls through it, and it's awesome to see the results that we've been able to get through that. So if you could just share the PDF that I sent you, we could get started.
All right. So just a small this thing, that when I will be sharing the screen, I might have to close both your videos. Is that okay?
Yeah.
No issues. Yeah.
We'll just check that out. I'll just see how that goes. Yeah. So just 1 second. I will just work out the sharing of the screen. I've got your video right here. Yes. All right.
Okay, awesome. We could go to slide 2.
All right.
I just wanted to quickly talk about what the pelvic floor is. And when we think of the pelvic floor muscles, a lot of the times we only think of one layer of muscle, but it's actually multiple muscles interconnected and layered on top of each other. And scientists are still trying to figure out what exactly these muscles do. We know a little bit about it, but we still don't know all of it yet. So the easiest way for us to think about the pelvic floor would be in connection with the core muscles and the respiratory system. So I want us all to imagine a canister, basically something like a Coke can, right? So on top of the can, like the top part of the can would be the diaphragm, which is the most important respiratory muscle. And under the can, the foundational muscle is the pelvic floor muscles. And on either side of the can are your deep abdominal musculatures and your multifidi, which are at the back of the can. So anytime you breathe right, you breathe into your diaphragm and you push down towards your pelvic floor muscle. So a lot of the times what happens now with modern lifestyle, high stress, we're constantly in our sympathetic nervous system. And because of lack of sleep, all of these things, we rarely breathe well. All of us are habitual chest breathers. What this means is our diaphragm is rarely engaged, and we don't really use the diaphragm to put the abdominal pressure on the pelvic floor, which means the pelvic floor doesn't get the stimulus it needs to from the core muscles and the respiratory system, which means the pelvic floor lies dormant and doesn't really do the work that it's supposed to do. If we can move on to the next slide, we can see exactly what the pelvic floor looks like. So I consciously put a male image here because a lot of the times we associate pelvic floor muscles with just women. I know this is primarily targeted women, but we also need to understand that the pelvic floor muscles are as important for men as it is for women. Of course, we are slightly more affected because of factors like childbirth. But basically what it does is, think of it like a hammock. It holds everything in place. So it holds our uterus in place, it holds our bladder in place, it holds our rectum in place, it supports our lower back, it supports our pelvic structure, our tailbone sits on top of the pelvic floor. And if we didn't have a very healthy functioning pelvic floor, we will not have any control over our urine, we will be pooping, peeing all the time basically. So the pelvic floor just makes us more support. It just supports everything and holds everything in place right there at the bottom. Most importantly, for women, it prevents incontinence, which is a very common symptom for most women after childbirth. But now with working with women, I realized that even through high stress, women do experience a certain amount of urinary incontinence. So what do we do to address the pelvic floor? If we can move on to the next slide. So why does the pelvic floor malfunction, right? So like I said, if you are shallow breathing, or a lot of the times, if you notice, some of us stick our lower backs out, we protrude our bellies, which means our canister is now not a straight line anymore, and there is a slight bend in that canister. So our pelvic floor is not aligned with our diaphragm. So we don't really breathe into our diaphragm, which doesn't put pressure onto our pelvic floor. So then the pelvic floor starts to malfunction. Pregnancy is another big reason why the pelvic floor malfunctions. So anytime anytime we give birth, especially natural birth, the amount of trauma that is handled by a urinary tract and the system associated with it puts a lot of pressure on the pelvic floor, and which means it's not going to function as well as before childbirth. Accidents, gym injuries, any kind of trauma directly on the lumbar spine or the pelvic structure will also affect the pelvic floor. A lot of the times, high intensity exercises, a lot of CrossFit athletes and people who do high intense strength training, they also deal with incontinence in the form of a weak pelvic floor muscle. So a lot of the times we associate strong people to not have dysfunctions like the pelvic floor muscle, but actually the stronger you are, the more care you need to do to make sure that you're using all your abdominal muscles correctly and doing the right breathing techniques to make your pelvic floor effective. So we can stop the slides with this, but certain things that we do need to, what we do need to think about is how do we activate our pelvic floor and how can we keep it healthy throughout. So a lot of the times what these magazines sell us are kegels. So all of us think kegels are great for pelvic floor, but what we fail to understand is that the pelvic floor rarely functions by itself. It functions in accordance with the diaphragm and your abdominal muscles. So kegels, while they are great and they could make your vaginal muscles tighter, they have very little direct impact on your pelvic floor muscles. It could feel like you're working those muscles, but rarely when you lift a weight, when you lift a child, when you sneeze, when you cough, your pelvic floor doesn't work independently, but it works in conjunction with the diaphragm and the core muscles. So instead of doing just kegels, what I like to do is to think about using your vaginal floor, your pelvic floor, along with your diaphragm. So here's a quick, easy drill that I'd like all of us to try now. So this is going to be a little graphic.
Sorry, Prashanti, what I'll do is, because you're showing, your exercise, I will just spotlight your video. Is that okay, Sir Ranjini? I'll just so that it's more clear. Is that
so
okay?
I'm just going to do it sitting down, and it's more like a mental imagery thing. This could be a little graphic for some of us, but just go along with me on this and you will immediately know what I'm talking about when you guys do this. So first of all, just sit in a very comfortable position. All of us can do this together, and this is something you guys can do as your warm up or just every day before you go to bed when you wake up. So now imagine there is a big cup of really, really thick chocolate shake in between your legs, and there is a thick, very, the thick shake straws that you get stuck up your vagina. Now what I want you to do is put your hand on your belly, take a big breath. When you breathe, you're going to think about pushing that hand away. So you want to put your hand across your belly all the way and not at the top, not too low, but in the middle of the belly. Now, as you take a big breath into your belly, pushing that hand away, I want you to actively imagine trying to drink thick shake through that thick straw with your vagina. So you can do this as slowly. You're not very hungry. We just want little sips at this point. As slowly as we can, try and suck that thick shake. The thicker the shake in your head, the better it is. Through that very thick straw through your vagina into your system. I know this doesn't make any sense and you're probably not going to drink thick shake for the next few hours, but that's okay. So just suck that in. Keep going, keep going. Now once your belly is filled up, I want you guys to exhale through your mouth and think about releasing the thick shake back into that cup through that straw very slowly. You don't want a big whoosh. You want a nice steady dribble back into that cup. Let's do this a couple of times. So breathe into your belly. I should be able to see your hands being pushed away. So from here, see how I'm pushing my hand away? I'm pushing my hand away, breathing into my belly, and I'm actively thinking about sucking thick shake in through my vagina with a very, very tiny straw. The smaller your straw, the thicker your milkshake, the easier this is going to be for us to activate your pelvic floor muscles. So breathe in and exhale through your mouth. Imagine you're trying to blow something away in front of you. Release that thick shake back into the same cup as slowly as you can. Now, what this does is it engages our diaphragm along with our pelvic floor muscles, and instead of just, so what you guys, the feeling that we're trying to chase at this point is, imagine you really need to use the restroom, but we're trying to control it because there's no access to the restroom. So now we know that the pelvic floor muscles are active, and we don't want to do this too often because the pelvic floor muscle can get hypertonic. What that means is it can get overworked, and that can also cause malfunction on a different way. So we want to do this either at the start of a workout or just maybe once or twice a day. But doing this regularly along with the breathing will help us make sure that the pelvic floor muscle is active. And as we get closer to menopause, I've noticed that women past 40, there are 1 in 3 women, that's what the stats say, who experience incontinence, even from like coughing, sneezing, sudden movement. So doing stuff like this right from the start will make sure that we prevent surprises that we don't want.
So, I know you've got to rush off, so we've got 3 minutes. A very quick question.
Yeah.
A lot of people ask us, actually this is something that Sivranjini, I'll speak to you later also about it. But, a lot of people ask us, Prashanti, that, their situation is already like quite bad when it comes to pelvic health. And like you rightly said, even younger women who have not gone through childbirth, they are starting to have pelvic floor issues. So how much of it can be reversed with, mindful and evidence-based physiotherapy?
I actually think that's a great question. Unfortunately, I don't know, at least in my city, and I've looked in other cities like Delhi and Bombay, I've not seen too many physiotherapists who specialize in pelvic floor health. So that is a big problem, but we definitely can get full pelvic floor function, no problem, with consistent work. What I do think helps a lot is lifting weights and strength training. Any kind of resistance training is the only way that we can get our menstrual health back on track, pelvic floor health back on track, hormonal health back on track. I think the importance of lifting weights for women is severely underrated, and I know that the stronger a woman is, even things like osteoporosis and all of that will have a direct impact on your pelvic floor because of your pelvic structure. So get stronger and find a physio who you trust and do the breathing drills and engage your diaphragm.
And can you, okay, 2 minutes are left. So
no, we have 5 minutes is okay.
All right. So, can you tell us a little bit more about the benefits of squatting? That is another very, undervalued sort of, thing that, earlier we used to do, but now not so much. So how can squatting help with pelvic health and so many other parts?
I actually think squatting is also, how we understand it now is very different from how we understood it back then. So there are a lot of people who say, all of us need to squat to full depth. I don't think that's true at all. I think we've evolved, our evolutionary methods are very different now. And just because our grandparents ate a certain way or moved a certain way, I don't think those rules apply to us. I hate it when I say, oh, your grandfather ate that way, why don't you eat this way? Because we have refrigeration and our activity levels aren't as much. Same thing, we have chairs, we have desk jobs. I don't think we should try and force ourselves to sit down in a squat position at all. In fact, even at the gym, we take our time with getting people to develop range of motion. All of us are built differently, and if we do force people to squat to a full depth, we could end up doing more harm to the pelvic floor than good. So I would say start by squatting to a comfortable depth by holding on to a support like a desk or a chair for 1 minute, not even 1 minute at a stretch, but build up to a minute. And then you could try going slightly lower. You can do the breathing drill that we just did from a comfortable squatting position. You'll notice that every time you exhale, how low you go will suddenly get, your squat will get deeper. because anytime you relax that core, as opposed to keep that core tight, which it can actually be a very counterproductive narrative. We need to learn how to relax our diaphragms, relax our pelvic floors, get comfortable at the bottom, and not force that extra range, which will actually make our pelvic floors weaker.
Wonderful. So, also one last question. I know I keep saying that, but this is truly the last. Pelvic health, we've spoken so much about gut health and digestive health throughout this conversation. And we know that pelvic health does matter when it comes to good digestion. So can you highlight a little bit, the relationship between good pelvic health and having a good gut health?
Yeah, so I think now more and more research points to, I was just listening to a podcast on gut health, and I think the more research we do on gut health, the more we understand that we actually don't know anything about gut health. I would say the same would extend to pelvic floor health. And what is more important for most of us is to focus on the big rocks. Make sure you're sleeping enough, make sure you're getting enough vegetables, make sure you're getting enough dietary fiber, make sure you're getting enough protein. And make sure you're drinking enough water. I think if we took care of these basics and limited processed food, all of us should be in a good place. And sort of, a lot of the times when people come to me, they say, can you fix my gut health? And I would be like, sure, but can you drink more water? They'll be like, no, I will not drink more water. Tell me what the magic pill for my gut health is.
Yeah.
That makes no sense. So focus on the big rocks, and everything else will most often take care of itself unless you have a very specific underlying factor.
I think that's great, Prashanti. Thank you so much for, very quickly and succinctly squeezing all that in. And the reason we, a lot of people give us this feedback that why is pelvic health being spoken in a website, in a webinar about menstruation. Mm-hmm. And I just feel that, it is very problematic, that when we essentialize and reduce all of women's health and all the research or the lack of it to just fertility and menstruation, and we forget how each of our health systems in our body are so interconnected. So thank you so much for bringing that in and time and for joining quickly. And
I just have one point to make about how this could be relevant, how pelvic floor health could be relevant in terms of menstruation. I think now menstrual cups are all the rage, which are amazing. I've been using a menstrual cup for as long as I can remember now. And what happens is the kind of pressure that a wrong size of menstrual cup or like a wrong insertion can place on your pelvic floor can accentuate pelvic floor dysfunction. Mm-hmm. So there are not too many sizes in terms of menstrual cup, but there is like a post-pregnancy and a pre-pregnancy size. So just talk to somebody who works in the menstrual cup field to figure out, what fold works for you, whether you're comfortable or not, and things like that. A lot of the times when women face leakages in menstrual cup, that's not because they're inserting it wrong, but because the pelvic floor is not, it's not working optimally to hold that menstrual cup in place.
Okay.
So that would be of value to add.
I think that's very interesting because, cup users are, including myself, we love the menstrual cup. And I think the biggest challenge, the learning curve is, how to start inserting, folding, all of that. So thank you so much for that insight. If you have the time, please stay on. Otherwise, we completely...
I will try joining back in a few minutes.
Sure, absolutely.
Thank you so much.
Bye.
Bye.